Dear Ava, thank you for talking to me about your health journey. I really wanted to know about the challenges which you went through to find what worked for you to improve your health and well-being. It wasn't a conventional approach. It was an approach which probably people would laugh at or question it or disbelieve it and disbelieve you, which is the worst of all, in my opinion. Can you tell me how did your disalignment within your body start? When did you first notice that?
Yeah, sure. I think I've always been pretty healthy growing up. I always could eat everything. I had a younger sister who had some, gastrointestinal issues and was diagnosed with a chronic illness at a very younger age. So I was always aware of that and what that meant. And also being a doctor myself, so I work in the emergency department. I'm currently in specialist training. I think I also just was very well aware of different pathologies, and I think it was now 4 years ago that I got influenza A. And then I became quite unwell with it, and I had to take a few weeks off, and ended up with sort of secondary bacterial infections and ended up on antibiotics. And right at the back end of that, it's, I guess because of my pathology, it's really uncertain as to whether they're related or not, but I ended up with really severe pain, gastrointestinal pain. And I ended up in hospital, which I didn't want to go to. The last place you want to go to is the emergency department when you work there, on your days off. But I ended up there, and they admitted me. And
was it your hospital or a different hospital?
It was a different hospital. I sort of lived a bit further away from work, so I went to the local hospital. A friend kind of dragged me there because she could tell that I didn't look well, and I had tried sort of taking some pain relief at home, and it hadn't helped. And so I went to hospital, and they had to treat me with some morphine, and they ended up doing a lot of different tests, and really not coming to too much of a conclusion as to why I had this pain. And I also was not tolerating food very well. So I was vomiting, and I had a lot of nausea. And I kind of, in a span of maybe 1 or 2 weeks, I'd lost a significant amount of weight unintentionally. And so
It's maybe cancer?
I think having been a doctor, I knew there was probably other reasons first before that, but I wasn't 100% sure what, because nothing was really showing up. They hadn't done any endoscopies or colonoscopies yet, and so they did that. I was very fortunate being a doctor. I have friends that I sort of did my junior years and intern years with who had become gastroenterologists, and they really looked after me, and they did a lot more investigations. And then together we kind of came to the conclusion of maybe doing a gastric emptying study, because I had some of the symptoms that seem to correlate with what is called gastroparesis, which is essentially paralysis of the stomach. And you can get it as a complication of viruses or a complication of other sort of surgeries or pathologies. And given that I just had flu A, they thought maybe that's what had happened. And incidentally, the gastric emptying study was abnormal, and I went and saw a motility specialist who was really supportive, and they knew that I was a doctor, and it kind of opened up. To be honest, gastroparesis is probably a disease process that doesn't get too much attention in medicine. I feel like in med school, I probably learned about it in the context of diabetics having it. I don't think I knew that a significant amount of people, or even young people that get it, there's not really a known cause. Whether it's an autoimmune disease or whether there's something else like a virus or bacteria that causes it, we don't really know. And I think there's about 300,000 people in Australia alone that suffer from gastroparesis. And unfortunately there's not really any good treatment for it. There are prokinetics, which are medications that help move the gut along, that help some people, but many people I certainly found that after maybe a few weeks they didn't help anymore. I often what happens is some of these, young patients end up on nasogastric feed, so they have a tube that goes down into the stomach and they get fed because that's the only way that they don't feel pain or discomfort.
Interesting. The next week is the tube feeding awareness week.
Oh, is it? I didn't know that. That's it. And I started to realize, I mean, it's hard to explain to people what it's like, but it's sort of like, imagine if you have like a horrible gastroenteritis, or let's say you're hungover, or you've got morning sickness because of pregnancy. You kind of think, oh, that's going to end, and that it lasts 1 or 2 days or whatever, and then you get better. But you feel that horrible all the time, every day, for months and months, and sometimes years. And I think I began to really rethink about how, because I knew I didn't want to have nasogastric feeds, and I knew that people that failed nasogastric feeds went on to have TPN, which is getting fed via the vein, and that diminishes your life expectancy, and even your life expectancy by a significant amount of years. So yeah, it was the suffering through the symptoms and not having relief. It's not knowing whether this was ever going to end, and also not being able to have anything to do to make it better. And you feel really helpless, and you feel, you also kind of feel a little bit like when we don't know something in medicine very well, there isn't much, there's definitely research that's going into gastroparesis, but it's limited, to say the least, and we don't, there's a few operations that you can do, they're not always effective. There's some young girls that I've seen with stoma bags, and I've met some of these people, and I really there's just a significant amount of suffering. They're young people that could have been very productive parts or aspects of society, and I definitely had to take time off being a doctor. I took 6 months. My mum had to come look after me. And so I think it was the uncertainty, and I think mentally, when you deal with chronic pain and symptoms that are uncomfortable and there's no relief and you don't really see the light in the end, I think you start thinking, a little bit more low in life, and you start getting depressed about things, and you start thinking, well, if this is going to go on forever, I might want to end things myself, because I can't see myself living like this. Just the quality is really poor. Quality of life.
I remember your father giving you a call once when you were in the hospital.
Yeah.
Saying, I think my daughter will die if she continues this way.
Yeah.
No pain.
It was, so I'd lost about 12 kilos in a 2 or 3 weeks. I'd been vomiting so much that I'd cracked a lot of my back teeth. It was really hard to hold anything down. No antiemetics or medications worked. There was times when I thought that I might die, to be honest. I wasn't 100% sure. There are people that do die from gastroparesis or complications thereof. But I think because it's such an uncommon illness, that I think not much attention is given to it, and not much awareness is there. And I do think that because, whilst I have so much respect and love for my own field of medicine, I do think that sometimes when we don't know the answer to things and there isn't enough research around it, we can kind of go into the realm of thinking something is functional, or thinking something is, related to like mind, gut, and it's not actually maybe a real pathological process. And there's been many examples in the past, and these are really bold statements I'm making, I think, about medicine, but as a senior doctor, I think I can make them. But I think, things like MS or endometriosis, or a number of diseases in the past that we put down to other sort of causes that weren't correct, and now we understand a bit more about, for example, autoimmune or exactly, even allergies like you were speaking about before. So I think I just got to the point where I was like, if I'm going to get out of this, it's not going to be the traditional way, because there really isn't an answer. And I think my colleagues, speaking to some of the, the best motility specialists probably in Australia, and also my own colleagues who are in gastroenterology, I think they supported me looking at alternatives, because they basically said whatever works, works, and if you can get out of that cycle, then do it. And so I went on a journey of Look, I've been always really open-minded about alternative options. But I studied, I went and sat in Ayurvedic doctors' offices, homeopaths, naturopaths, Chinese herbalists. I did Reiki, I did every possible thing. I even explored the idea of, is this actually just in my mind? But I was a very healthy, active individual. I was always at the gym. I enjoyed eating healthy food. I was in a great place in my life. I was doing what I love at work. I had great friends. I don't know why all of a sudden I would be, in the position that I was in. And, nothing really came out of those. And then it was probably about 6 months into being sick that I think my sister sent me a picture of a book. And it was the Medical Medium book. And around the same time, I had another girlfriend send me a photo saying, hey, have you heard about this? And they had both had friends that had told them about it because they had chronic illnesses. And it was kind of like the only thing that had worked for them was the, protocol, if you like, in these books. And it was largely around diet. And yeah, exactly. But it was about, and it was interesting. I think I kind of put it aside for a little while thinking, I've tried everything. Why would this work? And I think I went, my parents decided we should go away on a holiday for a couple of weeks and just get some air and try something different. Went to Byron Bay, and throughout that time I was pretty unwell. I just was not feeling great. But I remember we went into a bookstore and I saw the book that I had been, and it was only like $20, and here I'd paid all this money to see all these different, herbal doctors and specialists and so on, and I read the book, and it was fascinating because and even as a doctor, it kind of made sense to me. It was a lot around why a lot of people with chronic illnesses are getting sicker and sicker, and why maybe we might have missed the mark with how we're managing. And a lot of it has to do with maybe there's, the viruses and the bacteria that we get. We often think in medicine, once you have them, you're then immune, and you might have what we call like an IgG response, as in it's chronic and it's no longer affecting you. But the book talks a lot about what if that wasn't the case? What if the Epstein-Barr virus that you had in your body was actually continuing to cause havoc in other ways that we didn't think were related? And there was some interesting studies. Yeah, exactly. And, there's some interesting studies that came out of Harvard recently showing, the correlation between MS and Epstein-Barr virus, and even now certain cancers. And we know, for example, like hepatitis is related to certain liver cancers. And so why is it that we think that our others aren't, or viruses? And now that we've had COVID, the amount of respect that I think the medical industry, we now have for how, the long COVID and what it can do to your body. So maybe there's something more to that, and maybe some of our chronic illnesses are caused as a result of that. It's a theory, and of course we haven't had studies to necessarily prove those things, but it's actually not very far-fetched, and it's not something that's foreign to medicine. It's just something we haven't really spent too much focus on. And on top of that, things like, what environmental things are causing. We talk a lot about food intolerances. You were talking about food allergies before. There's a lot of food intolerances, especially in pediatrics. Now is, food intolerances, what is that? What does that mean? Why is it all of a sudden that people can't tolerate gluten, or they can't tolerate this, or eggs, or dairy, or whatever? The book just had so many fascinating explanations. And I was like, you know what? It makes logical sense to me. And the diet that he proposed in the book was easy enough, and I tried everything else, and it was actually really healthy. And so I was like, you know what, I'm just going to give it a go. Because
how did you start?
First day in Byron, I read the entire book, stayed up all night, read it. The next day, it has a lot of juicing in it. It has a lot of, use of fruits and vegetables. And it has a few foods that you're to avoid for various reasons. And so I started with the whole juicing, namely celery juice in the mornings. which again, like I think if people, as a Western doctor, I might have laughed at that 10 years ago or even 5 years ago. But, you're at a point where you're like, I'll do anything and I've tried everything and I just don't want to be sick anymore. And within a week, the pain went away.
Wow.
And then I cut out things like eggs and dairy. My nausea went away and I started to tolerate food better and I started to gain some of that weight back. I then, within a month of cutting out a few of those other things, I was back at work, functioning as an emergency doctor. And it's been a healing journey. It's been a process. Healing isn't always a linear line. It's sometimes, a little bit like this. But I'm now, I think, 4 years down the track at a point where, I used to be on Mattress Island where I couldn't get out of bed. I now can exercise and go out and meet with friends. And I think I've healed to the point where every so often, if I eat something that isn't necessarily in line with the diet, my body copes with it and tolerates it. But for the most part, I'm really happy with how I like what I'm eating, and I feel like I'm a healthier person. A lot of things got better, not only just the gastroparesis. I mean, I no longer have gastroparesis symptoms. That's completely gone. I used to have really bad asthma. And the asthma, I used to be on steroids every winter. I was using Ventolin twice a week. I was on a preventer. Haven't used any of that in 3 years. I had hay fever really badly. I was on antihistamines every day. Don't need it at all. Never get hay fever anymore. Just things like improved in general in my health. And my nutrition's the best it's probably ever been. In many ways, it's stopped me to, I think people for the most part can be healthy, but every so often you eat the wrong things. And I think this diet kind of stops me from doing that, which is nice. It kind of keeps me on the healthy track. I'm just exceptionally grateful to, I think you were talking about freedom, food freedom in the past. I now feel like I have the freedom to live my life without pain and without nausea and vomiting, and to just live a very normal life. Like I can go out with my friends to a restaurant now. I can still go out with my friends and hang out with them. Whereas before it was like they would have to come to my house and look after me or visit me, or I kind of felt more like a burden, if anything else. And I still, I'm part of those support groups. And I still watch, unfortunately, some of those people suffering. And I have reached out to some of them to say, look, this is my journey. If anyone's interested, there's been a couple people that have, and I've kind of helped them through that process, and they've found really great results. But then there's a lot of people, I think, and it's interesting because as a doctor, I think I'm probably a pretty open-minded person. But there's a lot of people that aren't in the medical industry and they have the disease, and they've told me things like, no, we're just going to wait for research to come out with an answer, and how would diet possibly ever change this illness. And I think one of the biggest factors about healing is that you have to want to really heal, and you have to be able to recognize that sometimes it doesn't come in the format or the way that you think it's going to happen.
That's a great advice for everybody.
I think we do wonderful things in medicine. I think I have so much respect for my colleagues, but I also think that there's, we're not perfect, and I think we're still learning, and we're still learning how to help people. And sometimes there's answers to things that we haven't just yet come around to investigating or looking at. And I just didn't want to wait for that to happen. I didn't want to wait 40 years of being ill, and I just didn't think I could.
So it was that desire to live life.
It was a desire to live and to feel like, and to just not feel like that anymore. I just didn't envision my life being sick all the time. It just wasn't for me.
And you found a way out.
Yeah, I know not everyone's always fortunate in that way. I think there's a lot of different chronic illnesses, different cancers, and there's a lot of different lethal pathologies. And like I said before, I'm just always really grateful for being given the opportunity to live my life again. Because for a while I wasn't sure what was going to happen. There was a lot of uncertainty.
If you were to meet Anthony Green tomorrow, what would you tell him?
So Anthony Williams, gosh, I would say to him, you are a legend, and thank you so much for helping me and so many people. I mean, it is kind of a bizarre way to think about it, because he doesn't, he's not necessarily from a medical background, and I am, but I do, like, everything I've read from what he's written makes theoretical sense to me, and I know that people have different judgments and views, but I feel like saying, find me something else that could have helped. Find me something else that gave me my life back, and maybe I would have looked at that too, but there wasn't. And so I'm eternally grateful. Yeah.
Thank you for sharing your journey.
No worries. Thanks.
Thank you.
Okay. Bye.